Yes, we've got someone in the building to talk to us about something very, very important.
Yep.
All
Yeah,
right.
guys, like this is the Mind and Body segment for the Midday Extra Show here at Eagles 102.3. And I always say, on days like this, I feel like a doctor because I get to say everything that a doctor will say. But, anyways, today, it doesn't lie. No, how do you say that? The honest does not lie on me because I'm not alone in the studio. We have a very fine enigmatic lady here with us. Her name is pharmacist Eradirin Yelarele. Yella Lere, oh Jesus, the L factor. But yes, she likes to be called Yella. Yella is a pharmacist at El Amang Pharmacy and Wellness and the Smile Outreach Network, Nigeria. Hello, Ella. Yella.
Hello,
Hello.
YY.
How you doing?
That's actually nice. I like
How
that.
you doing this morning?
I'm doing very well, thank you.
Yes, for the consumption of our listeners. Personally, I've had these misconceptions for many years, where all fevers are treated as malaria. Any little headache, any little joint pain, any little thing, we say it's malaria. That's how it used to do me. When it's malaria, when my malaria wants to start, my neck will pain me. So a lot of us do not even know what this is. So can you educate us? What is
Okay.
malaria?
Okay. Thank you very much. Well, that's something that I've noticed that's normal in Nigeria, that whenever one goes down with a fever, they just conclude it's malaria. When having a fever, it's just your body's way of telling you that you're not okay and something is going on, so do something about it. It's not necessarily malaria. So as we all know, malaria is actually caused by a parasite. I don't know if everyone knows, but the name of the parasite is, for Nigeria, the most prominent parasite that causes malaria is called Plasmodium falciparum. So when this enters your blood, it goes straight to your liver and then eventually affects your red blood cells and starts breaking them down. That's when you start feeling the symptoms. So the symptoms of malaria, of course, it includes joint pain, fever, chills, and all that. But that doesn't. If you have that, it's not only that you have malaria. But now we're talking about malaria, so I'm going to bring it down to malaria. You could have nausea and vomiting. You could be having diarrhea. You could have abdominal pain. So please, a disclaimer here: most people, when they have joint pain and abdominal pain, they just conclude it's typhoid. Typhoid doesn't just come like that. Before you have typhoid, you have to really have a very high level of it in your body before you can say you have typhoid. Typhoid, if you're having typhoid, you can't even walk. It's that bad. You can get that bad. So most of those symptoms direct you to malaria and not typhoid.
Okay.
So those are the symptoms of malaria. And then also the person could experience sudden attacks like shivering and chills, and then go back to having a normal body temperature.
Okay, there's this thing about malaria that everybody says. It's like when you start taking the drugs, that's when it increases, or that's when it awakens every single thing that is sickness related to you. How does this work? Is this about the drug or about the sickness itself?
Okay, so usually for a malaria endemic environment like Nigeria, the people in it, we Africans, we're very strong. A lot of things don't just get to us.
So
that
true,
easily.
disease not
Yes.
a killer, Sabi.
They kill us easily. We'll be strong people. So, because malaria is endemic here and we get infected with it very easily, then we now grow asymptomatic to it, meaning that our body develops partial immunity, which makes us asymptomatic.
Okay.
So sometimes we don't even feel the symptoms as severe as the malaria is in our body. So when you now start treatment, the malaria drug is now fighting the parasite, and then it begins to reveal exactly what is going on in your body, and then you start feeling worse, and then you now think that you were not sick before. It's the malaria drug that is making you sick. The malaria drug is just revealing exactly what was there because it's fighting the parasite
Okay.
and keeping you in the actual condition that your body is in that you don't know about, which is quite
Okay.
dangerous.
So when it starts revealing it, does it treat it immediately, or you take one dose to reveal and you take another dose to treat it completely?
Okay, so there's actually a timeline for your treatment. For
Okay.
ACTs like Lonart, the pharmacist or doctor will tell you your first 2 doses you take it 8 hours apart, and then the next one you take it 12 hours apart,
Okay.
like that. There's always a timeline. So the first few doses, now the first ones, usually what they do is they review the cell of this parasite, and then before it now starts killing the parasite cell.
Okay.
So that's why it's important to finish your dosing, because that's what also that brings me to the topic of resistance.
Okay.
Now when people start this medication, for those that now start feeling better, they now stop it,
Mm.
and the parasite is not yet dead, just expose the parasite. Now the parasite now learns the way of the drug. Now said, oh, so this is what this drug can do to me. Okay, let's mutate and form on something that will protect us against this drug. So the next time that person grows sick and you give the person the same drug, it doesn't work anymore.
Wait, so parasite gets us like this.
Say parasites. But seriously,
Yes.
it happens like that. So are you saying that it's not advisable to take one malaria medicine for a certain period of time? Because like how antibiotics, I know that antibiotics just have a 7-day period where you can take it. Anything more than that, is harmful to you as well. So is it the same thing with the malaria tablets?
You can take a particular malaria drug if it works for you for a long time, if you keep to the dosing. But the problem with this is that if one person gets resistant and a mosquito bites that person and gets the parasite from that person and transfers to another person, the person that got that transferred parasite also becomes resistant.
Okay, so that takes us to
No.
transmission.
You are
Wait.
not, this thing is not breaking down very well. If A treats malaria
Yes,
and takes a complete dose
yes,
and gets fine,
yes,
mosquito will now bite A and take it to B.
yes.
So you said that who form resistance?
Okay, here's the thing. If A is taking the medication
Mm-hmm.
but do not take it correctly,
Correctly.
Oh,
and the parasite in the person, you now think you're fine.
it
so
now
you stop
forms
the
a
medication.
resistance.
Yes. Now says, oh, so this is what this comes in to come and kill when it's coming. So the parasite is like, okay, let me build a wall around myself, and then the parasite does that. So the parasite is still in Mr. A's body, but he's still feeling okay for the time being. So a mosquito now bites Mr. A and takes this parasite and goes to Mr. B that is healthy and puts it in Mr. B. And then Mr. B now gets infected with that resistant strain that is in Mr. A. Then Mr. B now goes to take that same drug that he usually takes
It will not work.
and it doesn't work.
So now taking the complete dose is like taking the parasite by surprise.
Yes, it's like I must kill you.
So it doesn't have the opportunity
Yes.
Get that
to
resistance,
find.
yes.
So as they try,
Just-
go.
That's killing
That's
it.
the action for you like this. now.
Anyways, so how can this be transmitted? Like people say flu, if you cough close to me, I have it. Like Lassa fever, how can this be transmitted? Malaria.
Okay, malaria can be transmitted through the female Anopheles mosquito.
Okay.
For the mosquito strain, that's just it. But it can also be transmitted from mother to child
Mm.
when the mother is pregnant. That's
Okay.
why most times they advise antenatal and make sure you take malaria prevention, because a lot of malaria drugs, pregnant women can't take it.
Okay.
Yes, so it's advisable that you take the preventive therapy instead of taking treatment when you're already sick. That's why
Okay.
antenatal is very important, because they always test you to make sure you are okay and then give you preventive malaria drugs so you can be taking it to keep your child safe and you safe.
Okay.
Yes.
So now, when you go to the pharmacy to buy malaria drugs, they will tell you this is anti-malaria,
Yes,
but you already have the malaria,
yes.
and they'll still give you. Should be anti-malaria. It's supposed to be to prevent the malaria.
In this case, it's to treat the malaria. Anti, like two of us were not agreeing, so we
Okay.
are fighting. The preventive one is fancida. That one we call it prophylaxis.
Okay.
Yes, prophylaxis. So anti is coming to fight the malaria in the body. In this case, in the case of the medical world,
Okay.
that's anytime we add anti to it, it means that it
It's
kills
coming to
something
fight.
or it prohibits the growth of something.
Okay. Let's talk about the mother to child transmission now and why they're giving the preventive malaria to safeguard them. So, are you saying it's harder to treat a pregnant woman who's got malaria already, who's down on malaria already? So it's harder. That's why
You have to
during
take
antenatal, they're
preventive.
giving preventive
Yes.
malaria.
It's more advisable because most times it has to now be injections, because usually they tell you what drugs a pregnant woman can take and what drugs a pregnant woman cannot take. Yes, so in this case for malaria therapy they always advise the pregnant women always take a preventive therapy. Don't wait till you get down with malaria before you start treatment, because most times you can't take most drugs.
Okay.
And what if the one you can take you're resistant to?
To it.
And malaria can be dangerous, especially for children.
So how do you know the one that you are not resistant to?
Okay, most times in the hospital they do tests.
Okay.
Even for antibiotics, they check which one the person is resistant to before they give. Yes, they do.
So that's why it's
When you
important to
say
even go
Go
to
and
the
do
hospital.
tests.
They
Now,
do run
now for malaria, can the test reveal the kind of parasites?
Yes.
So-
if you do, not random test,
Okay.
blood test. It
Blood
reveals
test,
the kind
yes.
of parasite that is affecting the person or infecting the
Person.
person.
So you know
Yes.
what to
So I
give.
go to a
Yes.
lab scientist. I do my blood test.
Yes.
He gives me a result.
Yes.
I bring it to a doctor or a pharmacist.
Yes.
They know what to prescribe.
Yes. For that
So
one.
guys,
Oh,
if
we have
you're
not seen it that
listening,
way, oh.
yes, if you're listening, I think this is one of the major problem we have in this
Yes.
part of the country, where people don't get to the importance of going to the hospital to run the test is so that you can know what you should take. Because I know I'm a victim of this a couple of times. I fall ill, with malaria. I take the dose that I've been given. I wasn't given, actually. I bought. I take the dose that I bought, and then it doesn't work.
I don't
So
want to ask how many times they say, "Oh, I take on one the day."
do you
Take
get?
paracetamol morning, afternoon, and night.
So this is you putting yourself in harm's way by just prescribing anything to yourself.
And sometimes another reason why malaria drugs don't work for ACT combinations is because they take you with the wrong things.
Okay.
Like if you're taking anti-ACT combination specifically, you're not supposed to take orange.
I was getting to that.
Okay.
There are two things I was getting to. One is so a few medical friends around me have said you're not doing, because again, I like to take medicine with something sweet,
Sweet.
juice, tea,
Milk,
Sprite, something that we just remove the taste out of this thing.
And malaria has that
yes.
drug has that
It-
very.
Malaria can do you, it's not as if it's my fault. Growing up, that's what my dad used to use an entizer to take our medicine. But again, as you grow now, you don't have medical friends around, then they'll tell you, Baba, no, the best thing is water.
Yes.
The best thing. And you're arguing, and they're telling you vitamin C. But again, don't forget that when people are sick and they're getting better, no one go and visit them. Maybe we'll buy fruit.
Yes.
And we'll buy juice.
Yes.
And we'll buy watermelon. And we'll buy things. Go and get
Some people used to even put their own malaria drug in swallow.
Hey, you're getting better. Oh, take. We will now greet.
So let's
We will not greet you that someone that's not feeling fine with getting better. We will not greet you with fruit and juices and things. Now you say you should not take malaria medicine with juice. They've tried to explain it, but maybe in a layman's understanding, you can explain why vitamin C. You said ACT. Now we don't know ACT. We just know malaria medicine. So generally, in my head, it's a no. Then, if not, we're discussing malaria now. I also heard in terms of antibiotics,
Yes.
you don't do milk.
You don't do milk, you don't do yogurt, you don't do cheese, you don't do butter. You don't grapefruit.
Can you just break it down for us? What are the
We don't
do's?
treat antibiotics before what they use. What they use butter, chop bread, and tea now.
So what are the do's and don'ts?
Okay,
Yes.
for the antimalarials. Okay, for antimalarials, when you're taking them, for the ACT, like Lonat, Amatem, those.
What is
combinations.
ACT first of all?
Okay, artemisinin-based therapy, combination therapy.
Therapy.
That's
Okay.
what it means, yes.
So the malaria medicines are not ACTs.
Yeah, yes, they will have chloroquine phosphates. We have doxycycline, initial with quinine, sulfate.
And
all that.
those combinations are no longer so rampant.
Yes, because most people react to quinine. Even me, I react to quinine. If I take quinine now, my body will itch me for at least 3 days.
Yes.
So a lot of people no longer take quinines. So they go for the artemisinin-based combination.
Yes. So
that's why
unofficially, generally, ACTs are everywhere.
everywhere, everybody takes ACT. It's
No.
ACT. It's those that have become resistant that go for other combinations.
Okay.
Yes.
But why there's people say it's the chloroquine is more effective. It's just that the side effect is unbearable. Is that how true is that?
How true is that?
Chloroquine is not more effective. I wouldn't say it's more effective because it's relative to
Okay.
the person. So chloroquine is good, but depends on who is taking it. And if the person can bear the side effects, why not? Every drug has side
Side
effects,
effects, of
including
course.
vitamin C.
So
Yes.
what's the side effect of it?
If you take excess of vitamin C, you could start experiencing the side effects. Excess of it.
What
is
kind of
conditional.
side effects?
Like what? My body will now be yellow. Okay, so let's go back to the vitamin C and ACT.
ACT combination.
What's that mystery
Okay.
that is
Let
a
me
no-no
try
for
to
us?
Not use any medical terms. Let me try to break it down. Okay, so when you take vitamin C, usually anti-malaria drugs work by oxidation.
Okay.
That ACT combination. So they work by, there's something called radicals. They form radicals to work. But when you take the vitamin C, it stops that radical formation.
Okay.
So it completely now stops the anti-malarials from working
Okay.
at that point, because it's not allowing it to go the mechanism like the way it goes. If I'm killing this thing, I'm going like this, and then something now hits it here, and then it does not know what to do again at that point, because it is not yet prepared for such resistance. So it's like taking two things that I wanted to say
Opposites.
antagonizing themselves, but two things that are going against themselves
Okay.
in a layman's term. So that kind of thing, that's what happens. So it stops the anti-malaria from working
Okay.
properly.
Okay.
So vitamin C, multivitamins, blood tonic,
Should
all
not
of
be
that
taken with
together with
anti-malaria.
anti-malaria.
So he was saying something about what you should and shouldn't use to take your drugs, because I know it's very common. It's easier to swallow your tablets with
Juice.
pounded yam, juice, all those things.
But
So
what's up with swallow? As you
What's
said
the
now.
swallow?
Okay.
So what is?
You know,
Now
it
do
takes
nice
there's,
Eva and press it inside.
there's something called we call dissolution in pharmacy. When you take a drug, there is a time when they form the drug. There's a time that it gets to the stomach that is supposed to disintegrate, like separate and enter your blood. That's how it's formed. So when you take it in swallow, now before it will get to disintegrate the swallow, before it
Before
will
it
get to the drug, it
disintegrates
might have left the stomach and gone to the small intestine before you know you've
Passed it
pooped
out.
Yes.
Eh?
Yes. So it might not be working.
Thank God that I'm
Okay.
not trying this one.
So what about the drinks, like the juice, the milk?
Juice for antibiotics is milk.
Okay.
It's milk, grape juice.
You should take or you shouldn't
don't
take.
Shouldn't take.
Okay.
Don't take milk, don't take grape juice, don't take dairy products generally, yogurt and all that. Don't take it. Then for grapefruit, for the antibiotics. Then for the ACT, don't take orange, don't take multivitamins, don't take blood tonic, don't take folic acid. Don't take folic
Okay.
acid. Then don't take, I've said blood tonic, right?
Yes.
Orange, and then fruit juice. Fruit juice is usually a combination of fruits,
All
and
the
there is no
fruits.
way there will not be vitamin C in it. So it's just advisable to just even stay away from fruits.
So
because-
just take water.
yes, just take water.
All right,
But
guys.
I can drink use tea and take malaria medicine.
Yes, you can use tea and take malaria medicine.
But then after I'm done with treating malaria, I'm done with the doses and everything. How much space do I need to now resume vitamin C?
If you finish malaria drugs today, by tomorrow you can
Okay,
start.
resume vitamin C.
It's only 24 hours.
space, yes.
Okay, guys. Let's not. Now I've assimilated a lot of things. I need to go and digest it. Let's play you the song. When we get back, we will get into the conversation more. I mean, a notch higher.
Definitely.
Don't go anywhere.
One available Davido featuring Musa Keys, bringing us to 32 minutes gone past 11 a.m. here on the Media Extra Show. And yes, we're still here. We're talking malaria and all the things around that. And you think you know, right? You think you knew one of those things. Now you are being embarrassed that you don't know.
Anyways, guys, we have been hanging out with pharmacist Yella, and she's been so helpful telling us all that we need to know about malaria. If you did not hear anything today, you heard that you should not prescribe drug for yourself, because you are not the doctor that will know the parasite that is disturbing you before you go and drink combination that will cause you problem. Let's get to the severity of malaria.
Yes.
If you see how other countries treat malaria, you'll be wondering, is it this common malaria? These people they say you not enter the airports because of malaria. What's wrong with this ones? Malaria is not that deep. Nigerians, we have that quote a lot. How is that it is so severe out here and it is treated with such laxity?
As I said before about malaria endemic regions and the severity of the symptoms reducing and stuff. So people don't really know what exactly malaria is doing to them. They don't know that malaria is capable of causing organ failure. They don't know that malaria is capable of causing coma when it gets to cerebral malaria. And children are prone to cerebral malaria a lot. So when the symptoms don't really show and it gets to their brain, you start seeing them having convulsions.
So when they say high fever,
Yes, high fever, seizures, and all that. They'll start convulsing. The layman calls it convulsion. They start having seizures. And before you know it, they go into coma. You can see a child in 4 days, they won't come back. Like, they will not
From
come
the
back
coma.
and be active. They'll be in coma for 4 days. The only time they come awake, they go into seizures. That's how severe cerebral malaria can be. So it can cause low blood sugar, and very low levels of blood sugar can cause coma and still death. So malaria is actually very serious, but we don't know that malaria can be that dangerous because most of us, the symptoms have reduced, so we tend to treat it with a lot of laxity, and it's just malaria, malaria.
Just
Malaria is not just. Malaria can never be just, because malaria, the first place it goes to is your liver.
Okay.
And you can even experience liver enlargement from the malaria parasite infecting the liver. And then before it now goes into the blood vessels and start breaking them down. And then you think you have blood, but the cells in the blood are actually broken down. So you start experiencing anemia. And severe anemia could also kill someone. So it's a lot of dangerous
that's
things happening.
severe. Okay, now there's this misconception out there. I don't know if it's a misconception, but that's why you're here to clear it for us. A lot of people say AA are so prone to malaria that if you're AA, and I for one can attest to the fact that I can treat malaria two times in a month. So is it about their blood component? Is this true at all? What exactly is it about AA and the malaria pandemic in their lives?
I think first off, is it a myth or is
Or it's
it
just-
reality?
It's true. It's true.
So AA goes down
With malaria
faster
more
than
often,
AS.
and even
Okay.
SS.
So why is
And we
this?
used to swallow up. We used to carry our chest and like
We
AA.
are fried, we are AA. But
Because
truth,
because
for
AA is,
malaria,
if you check AA, it's a
All
spec.
perfect. They
Yes.
can mix. They can
It's-
mix
it's
up
a-
with
it's a-
any.
No, AA is a spec.
for malaria, we should humble ourselves.
Wow. What's a wow?
Okay, so there's this thing called a receptor on
Okay.
a full red blood cell. You know, AAs, we have full red blood cells.
Okay.
While for AS, they have a little bit of a curved shape on their red blood cells.
Yes.
While for SS, their own is like a disc shape.
Sickle. Or
Yes,
is it
sickle
this?
cell. Yes, sickle cell.
Okay.
So it's like a disc shape for the SS. So for the full blood cell, there's this receptor that malaria parasite binds to is there plenty for the full blood cell.
Sorry, take this thing again.
Okay.
For the benefit
God no
of.
create anybody
Yes.
complete.
Please, please take it again.
So for AA,
Mhm.
the full blood cell, it's round,
Okay.
like a CD plate. Let's use a
Yes.
CD plate.
Mhm.
It's like a CD plate. So there are things they call receptors on the surface of this round blood
CD,
cell.
yeah.
So when the parasite enters, it's very easy to bind
Okay,
and
because
just do
it's-
harm.
Mhm.
Yes. But for AS, they have a bit of, there's a curve. Like, how do I describe this? Like,
Sickle
this-
rice for farming rice. I be sickle.
it's like, yes, it's
This is
curved, but it's
sickle.
not as much as SS.
Okay. Yes.
So there's still, it's almost full, but it's not full. So the receptors they have, they are not as much as the AA genotype. While for SS, they almost don't even have the receptors
Okay, so they're not so prone to
to
malaria.
malaria.
So are you saying
Wow.
AA has those receptors
Yes.
because it's full, or
the
what?
round-
It's the round
yes,
thing
yes.
is
Okay.
So
full.
it's a lot of it in the cell. So the malaria parasite can just go and bind to anywhere it
But
wants
is
and just
there
take
an
it.
advantage of these receptors on a normal day?
Of course,
I won't
AA,
ask.
we are all
Okay, so
Wow,
that
Buga.
receptor is what makes us,
prone to malaria.
prone to malaria,
Yes.
but
It, ha-
But
it
they
has
are
both
resistance
sides.
not as prone to,
to malaria.
malaria as us.
Oh.
But I think what you're asking is that receptor now.
Yes, is
Is
it
there
does,
good-
yes,
is there
does
a
it
good
help
thing?
us? Does it do something?
Let's
for
know
the
whether I was
AA?
just selling our receptors now.
Because it's too much.
In relation to malaria, in relation to malaria infection, I would say no.
In relation to our well-being.
It's,
But
yes.
it's very.
That's what
That's
we
why
ask.
we are stronger.
Yes, is it
that's
Because
in
of these
relation to our
receptors.
well-being? Yes.
The reason why they would always say that AS, one of the AS, they are not very, I wouldn't say it's that terrible to be AS. It's not terrible.
Of course.
The only downside of it is you cannot marry another person.
Yes.
that's AS. So that's the only downside of it.
To
Because of
AS.
the dangers of having a sickle cell
Baby.
anemic child,
Okay.
which is painful for that child.
All right. So WHO said there's a vaccine for malaria.
Yes.
It's out there, but how come we don't see it anywhere here?
Yes.
Well, that question is very, very political.
But again, are the African countries that are on this already?
Yes, we have Kenya, we have Malawi, we have Ghana.
Okay.
They've been taking it for some time now. And
Ghana.
it's, yes,
People
Ghana,
that-
our backyard. That we've been telling them about July.
And it has been very effective.
Yes, it's been effective. They give it to their children, and in no time, they should be getting rid of malaria from their countries.
The same way we also gave out polio vaccines in the past, and we got rid of polio.
Yes.
And I mean, WHO certified Nigeria as polio free.
Yes.
The same way Ghana is currently wiping out malaria. Kenya
From
as
their
well.
country, yes. Even Malawi.
So we have a
Wow.
lot of work to do because
Wow.
I think that the amount of money generated in this part of the country for malaria medicines is a lot.
It's cash out.
Because a lot of people don't even go for diagnosis. They just guess
They just conclude.
and they
it's
conclude
malaria.
and they take. A lot of people consume these tablets without even having the right diagnosis. So that means if you're listening, change is possible. We can move out of this malaria.
Yes.
It's just that we need our voice to be out there more often about, changing this entire thing.
A proper legislation, a proper government with political will
Can eradicate
can
malaria.
actually get involved in this and eradicate malaria. Because again, I mean, I've got family members who went out of this country to probably do a master's or and they did all their documentation and all their tests and everything. For the 1 year or 2 years they spent outside this country, they didn't come down with malaria. Because like she said, it's more like you'll be quarantined. You may even be deported.
It is so serious. From the
You
airport,
may be
they detect.
deported.
You know how they do COVID? They do malaria tests. They run malaria tests in the airport or at the airport. So it's that serious. And when you come here and see how it's treated, that's why people don't even take it serious in this
Yes.
part of the country. So yes, there's this part that also says, I still feel sick after taking my malaria tablets.
Okay.
I've taken the complete dose. Now, this is not somebody playing games and throwing someone under the bed or whatever. But yes, I have taken the complete dose of my malaria tablets, but I still feel sick. What is responsible for this?
Okay, so as we said earlier, we talked about resistance already, if you're listening. So we've talked about resistance. Another factor that could cause that is resistance. You are either having the resistance strain or you already developed resistance without knowing to that particular medication. So you could try another malaria drug combination to see if it will work for you. While sometimes the drug is not taken correctly. While sometimes, as I mentioned earlier, you mixed it with something you're not supposed to mix it with, like
So it didn't
orange
get
or
the
something.
full
Yes,
effect.
it didn't get the full effect. While other times you need additional therapy, like you might need to take an injection first before you take the drug or
Okay.
something. Then, in most cases, as well, okay, I've talked about resistance, I've talked about all of that. So if you take your medications correctly and you are not resistant to any of them, then it's good. But anemia could also be a factor. You know, when the malaria parasite has already degraded a lot of red blood cells, so you're now feeling anemic. So even after you finish the treatment, there's no malaria in your blood, but because you feel weak, you still feel sick, you feel cold because your blood level is low, your blood count is low. What you need at that point, you need a blood tonic to spur up the production of red blood cells again, so that your blood level can be normal. In that case, what you can even do is to go for a blood count to know if your blood level is normal, especially your red blood cells, to know if it's normal. So you know if you really need a blood tonic or you just need additional therapy.
Okay. All right. So yes, this
Let's talk about this 1+, 2+, 3+.
severity rate.
Severity, bam. Yes.
Severity.
Now, I don't know how true this is, but I mean general knowledge that we have that malaria is inside all of us like this.
No.
Yeah. Thank God I haven't said it. So the thing is, I've had this general knowledge, and again I'll ask whether it's a myth or a reality.
Okay.
That's without D. Even if I'm not feeling sick or anything, if I do tests, I will see malaria.
No.
But that
Except you've
happens.
been infected with it and
But
you don't
that
know.
happens often, right? That even if you don't see, you just go for a general test, general everything.
And you're not
test.
feeling
And
down.
you're
no?
not down at all. But there's always
Malaria.
traces. You always have traces of malaria in your blood.
You know, I talked about endemic regions for malaria. You know, even if your house, you fumigated your house, you go out somewhere and mosquito bites. So now, because our body system, we
Mosquito
have
go
this
bite me, I don't know, say bite me. Will you
No,
whisper and
there
bite
are
me?
some that are not painful.
Yes.
There are some mosquitoes.
You
that
won't
Wow.
know. Yes.
You won't know. You just find it. Why there are some that are very painful.
Because
when they
you'll be
bite
itching it. I don't. When did mosquito bite me? That I
but then
didn't
you
even
see
know.
that
But you
something
see
hits
the
you.
redness on your skin.
Wait. So are you saying that, let's say you treat malaria,
Yes.
you take the dosages well,
Yes.
you feel better,
Yes.
you're not beaten, there's no malaria.
No malaria.
Then which is the one that a lot of things that you have told us. Oh. They told us that we in this part of the world we were born
Could like there's a coexisting.
No.
as if
That's
from our
a myth.
ancestors they gave us we were born with malaria like that. There's nothing we can do about it.
No, that's a myth. That's a myth.
Okay. So now that we know that,
Okay.
now that we know that malaria is not, something that is inherent, how can it be? Can it be prevented? If it can, then how?
Prevention is taking Fansida.
When you're fine.
Yes, when you're fine. You can take Fansida to prevent malaria. Like people that are coming to Nigeria from outside the country, they recommend, their doctors will tell them, when you come, please take prevention. Like we had a friend visit us once, and immediately she got in from the UK, she was like, please, can I get Fansida?
Fansida.
Oh,
So we just gave it to her. So she doesn't get the malaria. So when she's going back, this whole trouble on the airport doesn't happen. So if you can actually get prevention by taking Fansida and all, and it helps you. It helps you. So if you take the Fansida, it actually helps you, and then you just prevent yourself from getting the malaria. And also another preventive measure is keeping your environment clean. A lot of people don't know this, that stagnant water is breeding area for mosquitoes.
You do not lie. You do not lie. It's not a lie.
Wash your toilets. Keep your toilets clean. Keep anywhere that you know there will be water. Keep it clean. Let it be clean. If the gutter in front of you is too dirty, you just know that mosquitoes will breed there. So as much as possible, keep the environment as clean as possible. And then also, you can use mosquito treated nets.
Okay.
You can use mosquito treated nets and everything. So when especially for children, the children really need to use nets that are mosquito treated, because children are very prone to malaria, and it can be really, really dangerous. It can be dangerous for them when they go down with malaria. So use mosquito treated nets. Keep your environment very clean. And now we have mosquito repellent creams.
Yes.
And we have the one for the
going
clothes.
there.
Do they work?
Yes.
The handbands?
For what, man?
I
For the
don't know
clothes?
about the handbands, but the creams I know they do.
You said
And
you
even
have
the
for,
sprays.
Okay.
for
And
clothes?
sprays for clothes, yes.
Like perfs.
Yes.
Yes.
It's like perfume. You
Eh.
just spray it on.
Yes.
And then it repels mosquitoes.
Now I'll go to another question now.
Okay.
You're a pharmacist, yeah?
Yes. Yeah.
And so apart from you say you keep our environment clean and everything, and also once in a while let's fleet our homes.
Yes.
Let's use insecticide.
Yes.
Now, also a myth. Due to people's reaction to insecticide,
Yes.
they say that different brands now are bringing up maybe orange flavor, lemon. That is
Odorless.
Yeah,
Yes.
odorless,
Yes.
water-based, orange fragrance, lemon fragrance. They bring out different fragrances just so that probably can serve as maybe a perfume or a good this thing air freshener for the house.
Yes.
At the same time, deal with mosquito.
Yes.
But there's also general knowledge, unofficial, that when you use all those ones that are
Smelly.
very fine, that they
doesn't work.
raise to kill like that. Is that one? I don't want to call any brand
But
name.
on the
But
contrary,
is that one that we fleet and we go out?
but do you know that I've heard that the ones that that has a very pleasant smell,
Yes.
they are deadly.
I've heard that one that happens that smell is perfume. That one that when we spray like this, and what I was telling her should go outside, lock everywhere. After 1 hour, if we go and stroll in the area,
Yes.
that 1 hour will not come
Open
back.
the windows and everything.
And because I started wondering, is that how we like suffer head? Must we everything be suffer?
Exactly what I wanted
Apples.
to say. Nigerians, we like suffer too much. We believe that if something good is coming without us working for it,
You don't
we
deserve
don't
it.
deserve it. And it's not true. All insecticides are actually not safe for you to inhale them
Yes.
because they are poisonous. All of them, whether they
Both
smell
the
nice
pleasant-
or not. The only reason why they make the flavor nice is so maybe the house wouldn't be having this strong smell when
constant.
eventually it goes off. So they just use it as an air freshener, but at the same time it's an insecticide. So when you use it, you're supposed to leave the environment because it's dangerous. It can be poisonous.
Of
In
course.
severe cases, you will need an antidote for it.
Oh, an antidote. Anyways, guys,
So it's not bad to have the
No.
the cream.
Yes.
It's not bad to have the one that
Yes.
because I've seen these ones that are perfume, that are perfume, small like this. And it sends very well, but because that
Yes.
matter don't tell us, say, if we never suffer for something, you never. This thing is a very, it's
So,
not a good
so
stuff.
this is 48 past 11. I don't know if we should open up the phone lines.
We should.
In
we
case
should.
there are people who have certain misconceptions as well that they would like to ask the pharmacist here with us. It's 090-7353-0044 or 090-8766-8888. Your reactions, of course, are welcome on WhatsApp on 090-9705-4450. I forgot to mention that this is live streamed. Therefore, you can visit our website at www.eaglesfm.com. Download our app on iOS or Play Store. Link with us on YouTube and Facebook, Instagram, Twitter, and TikTok at Eagles FM Abuja. Let's see who we have.
All right, let's see
here.
who's here. Hello.
Good morning.
Name and where you're calling from.
I'm Hassan. I'm calling from Niger State.
Okay, Hassana from Niger. Welcome. Let's hear you.
I've treated malaria twice.
Twice?
But the medication, yes, this month. But the medications are not working correctly.
Okay. All right. The pharmacist will answer you, but I think she has made mention of something like that in her like presentation here at the station. But just stay tuned; she will respond to you right away.
Okay.
All right. Thank
All
you,
right,
Hassana,
thank
for
you
calling.
very much.
All right.
Okay,
Yella.
so I think we should just take. I don't know if there are more calls, so we'll just take them and then you respond to them in.
All right, we have
so
one more
first,
there.
she says she's taking the medicine, but there's no change. Yeah. Let's see what this one is saying here.
Hi. Good morning.
Yeah, good morning, Benedicta. How now?
This is
Okay,
Martha.
this is Martha.
Okay, good morning.
All right. Please, your name and where you're calling from.
I'm Biggie calling from Maraba.
All right. Please, let's hear you.
Yes, I really enjoy your analysis and your comments in the studio.
Thank you.
I want to say thank you for the good breakdown of some of these issues. I want to talk about what people misconception about our treatment, because the issue is some of us we feel hygiene, let me put it, don't affect Africa. So the way we both treat their malaria is quite different, and their nature of their skin, and let me say their health status, is quite different from ours. So we might not be thinking the same direction the way they think, because for them, once they have malaria, the symptoms will start showing up. But in our case, it's not like that. So that is the only thing I want to talk about. I'm really enjoying all your analysis in this video.
All right. Thank you
very
so much.
Thank you very
Thank you. I
much.
appreciate that contribution. All right, guys, we have a few minutes to wrap up this show. 090-7353-0044 or 090-8766-8888. Calling and sending your questions. There's someone here to respond to you. But in the meantime, let's answer what the other lady said.
Okay, let's take
Okay,
this
take
one,
one
and
more
then
call and
she
then-
wraps it up. Yeah. Who's here? Hello.
Off the radio. Hello, good afternoon.
Good
afternoon.
afternoon.
Your name, please, and where you're calling from.
My name is Chantel. I'm calling from Abo.
Chantel.
Chantel.
Yeah.
Okay, welcome,
I would
Chantel.
like to have to prescribe any cream I can rub for a 5-month-old, because I really have mosquito issues in my house. I do wash my toilet like every day, clean my house, but still the mosquitoes don't want to go away, despite I sleep. So is there any cream I can apply on my 5-month-old so that the mosquitoes will not be biting me for me?
All right.
All right.
So on your radio, I heard you say turn on radio. On it now and listen to the
Response.
response that you get from the pharmacist.
All right, thank you so much. Let's go straight into it.
All right.
because-
Yes. Let's go straight into it now.
Okay, so for the first person, you said that you've taken malaria drugs twice and it's not working. The symptoms are not going away. My question is, did you test? Did you test to see it's malaria before you started the medication? It might not be malaria. It might be something else, and you're suppressing the symptoms by taking drugs without checking it out. But if it's malaria, it could be possible that the particular one you're taking, you're resistant to it, so you need to change it. or you need additional therapy. But my advice to you would be that you should go to the hospital and get a test done, because it just might not be malaria. And if it's malaria, if you go to the hospital, they will recommend the right thing to take. If you need additional therapy, they will give you additional therapy. That's what I would advise you to do.
Okay, so the other person about the baby, 5-month-old baby.
Okay, so you said you clean your house and you fleet often, but I didn't hear you say you use a mosquito treated net for babies. That's very important for a baby. Think if you're not already doing that, I think you should use a mosquito treated net, because most of these products is very rare to see the one that is formulated for babies.
Yes.
But then some of these companies like this is not a paid advert, by the way. What's Forever Living products? All those kind of
all the supplements kind of things.
Yes. Some of them actually do sprays for the skin. So
Yes.
whenever you get something, please ask if
AIM
it's
Global,
for
those
children.
people.
Yes, they usually.
Yes, and even for the adult nets,
Yes.
we see that it's very reactive to the eyes.
It's because they do not dry it properly.
Yes.
When you get the net, they tell you to put it under shade for 24 hours.
So not sun.
Yes.
Guys, under the shade.
Under
When you get
shade.
your mosquito nets, you dry them under the shade. So
But-
that is not a child-friendly
No,
mosquito net.
there's the one for children. So
children.
you get the
Okay.
one for children.
So, but can she use those repellent creams
She has to read through to know if it's for
for
children.
children?
Yeah.
Oh,
So when you're
yes,
getting
that's
it,
true.
please, when you use the mosquito repellent cream, please read through it to see that it's for your child. And the man that talked about white people treating it more seriously. Please, malaria is a serious thing. We should never downplay it. The only reason why their symptoms are more severe is because they don't have malaria over there, and we do. And as I said before, endemic regions, the symptoms are reduced in us because our body has partial immunity to it.
Okay.
That's why the symptoms are reduced.
So although this message she sent, I don't know if it's related, but she said, "Hello, I'm Favor. If I'm pregnant, I always experience itching of body when taking my bath. I was thinking, what could be the cause? It's not malaria.
It's
It's
not
not-
malaria.
It's not discussion, but because we have a pharmacist
Yeah,
here,
it's not malaria.
I
So
mean,
what can be the reason?
what more can we do? She will just help us.
Okay, so here's the thing. For some people, they react to water sometimes. It's sometimes it's a case of pruritus that has to deal with water.
Okay.
There's a name for it. So what you do is I would recommend you use warm water when you're showering. Just use warm water. It actually helps with the itchiness. Always use warm water when you're taking a shower. It will help with the itchiness. This pruritus and you're reacting to the water. That's what happens.
All right, Favor, I hope you got that. But yes, this is a very safe place to wrap up this show today,
Yep.
guys. Remember, it's Eagles 102.3 is value or nothing. I hope you have had enough value for your time. Thank you so much, Pharmacist Yella, for sticking around with us today. We really appreciate your presence here. And yes, guys, the next hour is for the workstation. You don't want to miss it for anything. You know what happens at the workstation. See you again in the next hour.